Thank you for staying with us. World Hepatitis Day is recognized annually on July 28 and provides an opportunity to raise awareness on the global burden of viral hepatitis. In 2016, the World Health Assembly endorsed the elimination of viral hepatitis as a public health threat, including elimination of mother-to-child transmission of hepatitis B by 2030. And the theme of the campaign this year is "We're not waiting for change, we're fighting to make it happen." To have this conversation with us this morning is Chidinma Opia Ikechukwu. She is a designated registered nurse, a midwife, and an occupational health nurse. Good morning, ma'am. You're welcome. All right, we'll go on a short break and try to reconnect with her, and then we'll return and bring you this information. Stay with us. Welcome back. We apologize for that quick timeout. But currently we have Chidinma Opia Ikechukwu. She is a nurse, a midwife, an occupational health nurse, and she'll be having the conversation around World Hepatitis Day with us this morning. Good morning, ma'am. You're welcome. Are you there? Can you hear me?
Yes. Good morning, everyone.
You're welcome. Let's start this way. Give us a definition or explain what hepatitis is and what it's all about.
Okay. Thank you very much for giving me this opportunity. And welcome to this year's World Hepatitis Day. This year, every 28th July of every year, World Health Organization commemorates World Hepatitis Day. And this year's theme is One Life, One Liver. What was the reason for choosing this day to celebrate World Hepatitis Day? Well, globally, about 3,000 people die from hepatitis B and C every day, which means that every 30 seconds, someone loses their life to hepatitis B and C. So for this very reason, World Health Organization highlights the importance of Liver for a Healthy Life, the need to scale up viral hepatitis prevention, testing, and treatment to manage liver health, prevent liver disease, and to achieve the 2030 hepatitis elimination goals. So how do we achieve this goal? Well, everyone needs to be aware of what viral hepatitis is, what causes it, its symptoms, mode of transmission, and ways to prevent it. So this brings us to the question, what is hepatitis? Let's break the word down. The term hepatitis means inflammation of the liver. The first four words, hepa means the liver, while the other last word means inflammation, that is titis, so meaning inflammation of the liver. So when the liver is inflamed or when it is infected, it affects the liver function because it's vital organ that processes nutrients, filters blood, detoxifies drugs, and it also fights infection. So whenever this liver is inflamed or damaged, the function can be affected. So for this very reason, World Health Organization stresses on the need to reduce new hepatitis infection by 90% and death rate by 65%. So what can cause this hepatitis? Well, the major cause of hepatitis is virus, and there are some other predisposing factors to this infection, which are excessive intake of alcohol, drug misuse, and exposure to toxins. Hepatitis is classified into 5 different main types, which are hepatitis A, B, C, D, and E. But the most major aspect of it is hepatitis B and C. Why do we consider it the most common of it? Well, hepatitis B and C, if not properly managed or treated, it can lead to liver damage, liver cirrhosis, or failure of the liver. And eventually, it can lead to cancer or even death. So, what is the mode of transmission of this hepatitis? For hepatitis A, it can be gotten through ingestion of contaminated food or water, which is infected with hepatitis A virus. And for hepatitis B, when someone comes in contact with hepatitis A virus in the fluid, such as blood, vaginal secretions, or even semen, hepatitis C and D are similar to hepatitis B because they are also true body fluid like blood, vaginal secretion, and even semen. So for hepatitis E, one can get it when someone is exposed to hepatitis E virus, which is gotten from contaminated food or drink. So the symptoms of this disease, people living with hepatitis can present with symptoms like fatigue, flu-like symptoms like cold, cough, sneezing, and all the rest of it. Then in their urine, you will notice that their urine is usually dark. Their stool is usually pale or light colored. Then for their skin, you will notice a yellowish discoloration of their skin, the eyes, which we call jaundice. And some also might complain of weakness of the body, or you might even notice an unexplained weight loss. So how can we diagnose this hepatitis? One way to diagnose this hepatitis is through blood tests known as liver function test. This test helps us to know how effectively the liver works. Another way to diagnose this liver disease is through liver biopsy. So a liver biopsy involves taking a sample of the tissue from the liver, and this helps us to determine whether the inflammation has affected the liver or how long the infection has taken. Then for another thing that can be done is abdominal ultrasound. Abdominal ultrasound helps us to detect whether there is any tumor in the liver or whether there is any damage or enlargement of the liver. So the ways in which we can prevent diseases through vaccination. So for hepatitis A, children under the age of 12 to 12 months can get vaccinated with hepatitis A vaccine. Then for hepatitis B, the vaccine can be given at birth, and people under the age of 60 can also get this vaccine if they've not been vaccinated in the past. So another way to prevent this hepatitis is by practicing effective hygiene. Then reducing the risk of coming in contact with fluids containing these viruses by not sharing needles, syringes, toothbrushes, or even touching spilled blood. The last way to prevent this infection is by using barrier methods such as condoms and dental dams during sexual intercourse for people that are sexually active. So, if this hepatitis is not properly managed, it can lead to complications like bleeding disorders, accumulation of fluid in the abdomen known as ascites. It can as well increase blood pressure in the portal vein, which we call portal hepatitis. Then it can also damage the kidney. It can also lead to enlargement, hepatic encephalopathy, which involves memory loss, diminished mental ability, and even weakness. And if not properly managed, it can also lead to cancer of the liver. So from cancer of the liver, eventually death. So what are the treatments of hepatitis? Well, hepatitis treatment varies by the type of hepatitis or whether the infection is acute or chronic. What do I mean by acute and chronic? Acute means that the disease is short-term, and chronic means that the disease has lasted for over 6 months.